Imagine a world without modern medicine. A world where a headache could be a death sentence, and brain injury meant certain doom. Yet, amidst the darkness of the medieval ages, glimmers of surgical ingenuity shone. Surgeons, armed with crude tools and limited knowledge, dared to breach the skull, venturing into the most mysterious organ of the human body, the brain. This is the story of trepanation, a prehistoric and medieval surgical procedure to drill or scrape a hole in the skull, and the astonishing evidence that sometimes, against all odds, it worked. Trepanation wasn't limited to one culture or era. Evidence of this practice has been found across the globe, from ancient Europe and Asia to South America and Africa. Skulls bearing the telltale signs of trepanation date back thousands of years, predating even the written word. What drove our ancestors to perform such a radical procedure? Was it desperation, a last resort against debilitating ailments, or something more, something ritualistic? The reasons behind trepanation are shrouded in mystery. Some theories suggest it was used to release trapped demons or evil spirits believed to be causing illness. Other explanations point to treating head injuries, fractures, and even conditions like epilepsy and migraines. By creating an opening in the skull, surgeons may have hoped to relieve pressure, drain fluids, or simply provide an escape for whatever malevolent force was believed to be lurking within. Medieval surgeons lacked the sophisticated tools we have today. Their instruments were often crude, made of bronze, obsidian, or even sharpened stones. The primary tools for trepanation included drills, scrapers, and saws. These were used to slowly and meticulously create a hole in the skull, a process that could take hours. Sterilization was virtually non-existent, making infection a constant and deadly threat. Imagine the scene: a dimly lit room, the air thick with the smell of herbs and fear. The patient, often restrained, lies on a makeshift table. The surgeon, clad in simple garments, begins the arduous task of trepanation. Using steady hands, they meticulously drill or scrape away at the skull, layer by layer. The patient's screams may be muffled by herbs or potions, but the tension in the room is palpable. Remarkably, many trepan skulls show signs of bone remodeling, indicating that the patient survived the procedure and lived for years afterward. This process, where bone grows back around the edges of the hole, is a clear testament to the body's ability to heal, even after such a drastic intervention. These skulls offer undeniable proof that medieval surgeons, despite their limitations, sometimes achieved astonishing success. Some trepan skulls exhibit a level of skill that defies expectations. The holes are precisely cut, with smooth edges and no signs of excessive trauma. This suggests that the surgeons possessed a deep understanding of anatomy and the delicate balance of the brain. These well-trepanned skulls are a source of fascination and wonder, raising questions about the extent of medieval surgical knowledge. Without modern anesthesia, medieval surgeons relied on herbs, alcohol, and even hypnosis to manage pain. Opium, derived from poppies, was a common painkiller, although its addictive properties were not fully understood. Some surgeons may have also used techniques to induce a state of altered consciousness, allowing patients to endure the procedure with less suffering. Infection was a major killer in the medieval era, and surgery was particularly fraught with risk. Without proper sterilization, bacteria and other pathogens could easily enter the body through the surgical wound, leading to sepsis and death. Surgeons often relied on natural remedies like honey and herbs to fight infection, but their effectiveness was limited. Medieval surgeons often turned to nature's pharmacy for treatments. Herbs like willow bark, a source of salicylic acid, the active ingredient in aspirin, were used to reduce pain and inflammation. Other herbs were believed to have antiseptic or wound-healing properties. While not always effective, these remedies offered a glimmer of hope in a world with limited medical options. Trepanation wasn't solely a physical procedure. It often held spiritual significance. In some cultures, the hole created in the skull was believed to be a portal to the spirit world, allowing shamans or healers to communicate with the divine. This connection between the physical and spiritual realms highlights the complex beliefs of medieval societies. The Renaissance saw a renewed interest in classical knowledge, including ancient medical practices. Surgeons rediscovered texts describing trepanation and began to experiment with the procedure once again. While still risky, these Renaissance surgeons built upon the knowledge of their predecessors, pushing the boundaries of medical possibility. Ambroise Paré, a renowned 16th-century French surgeon, made significant contributions to the field of surgery. While not solely focused on trepanation, his innovative techniques and emphasis on anatomical accuracy helped to improve surgical outcomes overall. Paré's work marked a turning point in the history of surgery, paving the way for future advancements. It's important to remember that trepanation was often performed as a last resort, when all other treatments had failed. Patients were likely suffering from debilitating conditions that severely impacted their quality of life. In these desperate circumstances, the risks of surgery may have seemed a small price to pay for the chance of relief. Even in the medieval era, ethical considerations played a role in surgical decision-making. Surgeons faced the dilemma of balancing the potential benefits of surgery with the inherent risks. The decision to perform trepanation was likely not taken lightly and involved careful consideration of the patient's condition and the surgeon's skills. Despite centuries of research, many questions about trepanation remain unanswered. Why was it so widespread across different cultures and time periods? What were the specific conditions it was used to treat? And how did medieval surgeons achieve such surprising levels of success with limited resources? The mystery of trepanation continues to fascinate and intrigue us. The story of trepanation offers valuable lessons about human resilience and ingenuity. Despite facing immense challenges and limitations, medieval surgeons dared to push the boundaries of medical knowledge, developing innovative techniques and treatments that, against all odds, sometimes succeeded. Their story is a testament to the enduring human spirit. While trepanation may seem like a relic of the past, it has modern parallels in neurosurgery. Procedures like craniotomies, where a portion of the skull is temporarily removed to access the brain, are still used today to treat a variety of conditions. Modern neurosurgery, however, benefits from advanced imaging, anesthesia, and surgical techniques that were unimaginable in the medieval era. Trepanation has captured the imagination of writers, artists, and filmmakers, appearing in various works of popular culture. However, these portrayals often romanticize or distort the realities of the procedure. It's important to separate the myth from the reality and to understand the true historical context of trepanation. The tale of medieval trepanation is a captivating blend of mystery, skill, and sheer audacity. It reveals a time when medical understanding was limited, yet surgeons dared to explore the most complex part of the human body. While the risks were immense, the evidence of successful procedures offers a glimpse into a world where human ingenuity and a will to survive pushed the boundaries of what was possible. It reminds us how far we've come in medicine, while also acknowledging the courage and resourcefulness of those who came before us.